Now, hip replacement is done, it's all gone very successfully, and they see you at 6 weeks, everything's fine. Now, we did mention that there may be a 1% risk of complications. What do you tell your patients before and after the procedures about complications?
So there are a number of complications that can occur, and it is very important not to overwhelm the patients with 101 complications, but introduce it in a very precise manner. And also it is quite important as a patient for you to do your research about the complications that are there. So the main complications I would describe as infection. So the infection mainly occurs from the skin bug which you have. Everybody has got bugs in their skin. Those are the bugs that gets into the wound. So hence what Mr. Jacobs said about chlorhexidine bath before surgery is quite vital. So infection is one risk factor. Nerve damage. Nerve damage is very rare, but there is still a possibility of nerve damage, which in case of the hip replacement is a big nerve called sciatic nerve. Majority of the nerve damage, if it occurs, it's very temporary and it goes off, but there is a risk of nerve damage. The third risk factor which I describe is dislocation. And a dislocation of a hip joint is something where once you put it in, the hip dislocates, because you can appreciate the muscles are the muscles are slightly weak because we've gone into the hip joint. Some of that is because of positioning of the implant, and some of that is that the precautions that one has to take after a hip replacement has not been taken into. One of the other complications is deep vein thrombosis. Deep vein thrombosis can lead on to pulmonary embolism. That is when the clot has traveled into your lungs. I'm afraid if the clot travels into your lung, there is a chance of death here. We do give anticoagulants for that, but there is a very small chance of death there. These are the main complications I described. The other complications are leg length discrepancy. Now, Mr. Jacob, what do you tell patients about the leg length discrepancies?
So in my practice, I take utmost precaution to avoid a leg length discrepancy,
Sure.
and I use a few set of special jigs that keeps the error to a bare minimum. Now, one needs to realize that in most human beings, the legs are not the same length. We all have at least a centimeter difference and discrepancy, and our body manages to adjust itself. The body can cope with at least 2 centimeters of discrepancy, and over and above that, especially if you have a pre-existing spine problem or a pelvic problem which cannot compensate, then I would advise my patients to visit the appliance department, and the orthotics can try and put a little bit of a heel wedge or a shoe raise just to stabilize the pelvis, keeps your muscles in optimum condition and keeps your pelvis level. So by and large, the chance of having a leg length discrepancy without my knowledge is less than 1%. If for some unforeseen circumstance it does happen, then there are some get out of jail cards that we can employ to minimize the discomfort from difference in leg lengths. I always tell my patients about risk of heart attacks and strokes, and as you said, clots in the leg and lung, even death. And it's something that we try and not overwhelm you, but it's something that we have to mention so that you go into this operation with your eyes wide open.
And you get informed consent. You're making consent. You wouldn't go and buy a car without knowing everything about the car which you're buying. So it's our responsibility to tell you everything what you're buying into.
How long would you stay in the hospital?
Your hospital stay is for you to be safe, for the physios to know that you're safe and you're able to do everything safely at home when you reach home. Now, my advice is that you should stay in the hospital only for the time that is required, because hospital has got other patients, they can have other bugs in them, and you can have cross-contamination or chance of infection. So answer to precise questions, the average stay is about 2.5 days. Some patients go home in 24 hours, and as you are a great advocate of 24-hour hip replacement, it really depends on how safe you are at home. But majority of my patients, I'm sure your patients also go home by about 2.5 days.
And once you're home, do you advise them to go straight, hit the ground running and literally run, or would you?
So that is a very good question. There are a number of hip precautions you have to take when you reach home. I think we will show that in our next video, precisely focusing on hip precautions when you reach home.
So thank you for tuning in about hip replacements. As you know, hip replacements can last anything between 10 and 20 years. That's the ballpark figure we give, but it depends on how well you respect the hip replacement. Although you're capable of running and skiing and doing all sorts of sports, we try and advise that you minimize impact loading activities to get the best out of a hip replacement. Now, if you tune into our channels, you will find more detailed answers to various questions that may be niggling you, and we hope you'll get benefit out of listening to us. Thank you for visiting our channel, and to give us some feedback, and hope to see you again.
And remember, your health is your responsibility. Hope to see you again.